Hey there, Doc. The sixth thing we're going to talk about today that you need to do towards the end of this year to get ready for 2014 is probably the one I see missed the most. And for some reason, people just don't think about it, but it's very, very important. In fact, it's probably the cheapest and easiest way to grow a practice. Most doctors that call me to evaluate the practice think they need more new patients. Seldom the case. I always tell most of my doctors that they could hit their dream practice with the number of new patients they have right now if they did this step, which is a capacity checkup. Capacity is definitely the, as I said before, easiest and most inexpensive way to grow a practice, to look at what's available to you that you're already not using. So I want you to do a capacity checkup here towards the end of the year. And the very important thing about a capacity checkup is you got to make sure, obviously, you can see more people. But you got to do that during your busy times of the day. And that's the part that gets most of my docs, is they think, well, you know, I'm busy 3 to 6, but from 1 to 3, I just sit there twiddling my thumbs. If I could just do some marketing and put some people in those spots, I'll be fine. It's just not the way it works, Doc. You've got to be able to see more people when people want to be there. Think about a restaurant. You know, restaurants are going to market to try to get you to come eat dinner at 3:30 in the afternoon when they have nobody there. They're going to have light staff at that time. They're just going to shut it down, take care of the few people that come in. But come dinner time, 4:30 and on, they're going to be fully staffed. They're going to be able to handle just about anything that you can throw at them. Same thing has to go with your practice. You've got to make sure everything's in place during your busiest time of the day that you can see as many people as possible in that time. And if you do that, it'll spill over to the slower times of the day. Meaning if you see a certain number of people at 4 to 6, let's say, and you can see 20% more, you'll also see 20% more during your slower time. But again, that's your slower time. That's not the bulk of where the practice is going to get built. So how do you know if you have a capacity issue? Pretty simple. Your stat sheet, stat graph looks like that. Just if it's going up and down and you're doing that roller coaster thing, you're just kind of hitting that glass ceiling that everybody talks about, pretty good indication that you have a capacity issue, because your capacity is right there. And every time you go above that and you push and you surge for just a little bit of time, something breaks down. Something gets uncomfortable. Any of these things that I'm about to talk about gets uncomfortable. Whatever the lowest common denominator is, the thing that can handle the least amount of stress is going to break down. You're going to take a dip. You're going to get down here and you're like, oh, I got to do something to get this practice back up. You push hard again and you get back up, but again, it gets stressful. This doesn't work. This is a stressful roller coaster ride. It's just not fun. And brings me to a good point. When you increase your capacity, which is what you need to do here, you need to get your capacity up there where you can handle more. Then even if you're hanging out down here, which is better, it will be easier. And that's a hard thing for people to grasp. Practice success, when you increase your capacity, as opposed to trying to stuff more new patients in and working harder where you're struggling, that level of success is easier. You look at any practice success. Somebody producing $10,000, $15,000 a month and struggling to do so, that's a lot harder than some of the docs. If you go and see a $60,000, $70,000, $80,000 a month practice, and you watch that doctor, it seems easier. No different than like a professional athlete. You watch somebody who doesn't know how to swim, try to swim fast, and they're thrashing all about. There's water flying everywhere. You watch an Olympian, and it's smooth, and it almost seems effortless the way they glide through the water because they've refined it. Same thing here. You've got to get your practice to feel effortless. It will actually be easier. And that's one of my favorite things when I do consulting and I walk in and it's a capacity issue and I fix those capacity issues and I leave and the practice goes up 20% very, very quickly. That's cool. But my favorite part is when a doc calls me and tells me, yeah, we went up 20%, but the coolest thing is it feels easier. Like there's less stress at the end of the day. So that's what I want for you. And that's why we need to deal with this capacity checkup. So a few things you need to look at. First thing you need to look at is your staff. We talked in a couple earlier ones about, maybe there's staff that doesn't need to be there anymore, but today I'm going to talk about, do you have enough staff, especially at your busiest times of day. Everybody gets upset about their payroll, but staff, especially at this level, if you're right here and an extra staff member can get you up there, they're worth it because you're certainly not going to pay them that much. An extra staff member has to help you see a couple more patients a day. That's it, in order for them to break even. If they can help you see 10, 15 more patients a day, they're well worth it. So do you have enough? Are they motivated? We talked earlier again in number 3 about getting rid of some people that might just be hanging around. we got to look at that, and we got to motivate them. Whether it's a bonus system, if they're motivated by money, or maybe they just need a pat on the back every once in a while. Whatever it is, make sure that they are turned on to your practice and want to help you grow. Are they trained? And that's very different from being taught. You may have taught them something, but if you haven't trained them, they're going to be a capacity block for you. So make sure that that training happens consistently, and that they are as good as you want them to be. Last thing on staff is, are they personality matched to their position? So is the grumpy analytical woman who should be in the back doing insurance, is she up front answering the phones? We don't want that. Is the bubbly, vibrant personality in the back doing something where nobody sees her? Don't want that either. So make sure that they're personality matched. Next thing you want to look at is your price. Prices have to be competitive in order for you to have good capacity here. If people are calling your office asking how much it costs and it's too high and they hang up on you, we have a capacity issue. We can't get enough people through that door. This changes based on your status. If you have expert status, your prices can go up. But you've got to find out what the rest of the market is offering. You've got to keep that barrier of entry down, meaning we can't be charging a whole bunch of money for that first visit. People are willing to pay for the care, but we really got to consider getting the barrier of entry down so people get in your door. And if your prices are reasonable, we won't have a capacity issue there. Next thing I want you to look at is your report of findings. Are you overselling or underselling the case? Are you recommending too many visits, more than you think they need, or too few visits, which is probably more often the case? If I look at my doc's PVA, and then I go and ask them, what do you believe the average patient needs, and it's 3 times higher than their PVA, we have a problem. They're just underselling a case. And it's as simple as looking a patient in the eye and telling them this is what you need. Even if you tell them do whatever you want, you still got to tell them what they need. Number 2 is, are you pushing too hard? Are you trying to sell too hard? Are you trying to, if they have an objection, are you trying to meet it, which is selling too hard, or are you selling too softly? Are you just letting people walk all over you? So somewhere in the middle is a happy medium for you, and you got to find that. Next thing we want to talk about is your treatment time, which is probably the biggest capacity block there is, especially at the busiest times of the day. If you can only see so many people during the course of a day, in that busy hours, if you shorten that treatment time by 10%, 20%, so if you're normally a 12-minute doctor and you get down to 10, or if you're normally a 5-minute doctor, you get down to 4. All great, will open up some more capacity for you. But you've got to look at that and make sure that you're not wasting time. I don't want you to give a shabby adjustment by any means, but just make sure that you're giving the adjustment, no more, no less. If you're spending time face-to-face with the patient, talking about the weather or football, that's inefficient, especially at your busiest time of the day. I say that, but you also have to be consistent here. You can't give a different treatment time in a slow time than you do at a busy time, because then if a patient comes in, they get used to that 10, 12, 15, 20 minutes of talking, and then they come in during a busy time and you don't give it to them, you give them your normal adjustment, they're going to be up front asking, hey, what's wrong with him today? So make sure that you're consistent in your treatment at the time, and it fits your particular procedure, your particular method of care. Doesn't matter what it is, just make sure it's as quick as it can be, but still very, very effective. Next thing you want to look at is your space, which most people look at and say, well, do I have enough space? That's definitely an issue. If you need a second adjusting room and you only have one, so you can move a little faster, that's an issue. I got to deal with it. But probably more of an issue is having too much space. Too often I see docs that are just distracted because they have 3 rooms in the back they're not using. They're trying to rent them out to a massage therapist for $300 a month, and I'm not against massage therapy. I'm not against renting your space. But if that's your focus and you're losing it, you're not paying attention to this stuff, you're losing money for $300 a month. So if you have too much space, consider getting rid of some of it. If you do have to rent it out, but really focus on these things and the capacity that you have to produce the best income, which is by you being at a table. Next thing we want to talk about is your equipment. Again, do you have enough? If you do anything other than the adjustment, well, even the adjustment, do you have enough tables so you can go table to table, whether it's just 2 so you can go back and forth, or 3 if you need them with your particular technique. If you do any kind of therapy, rehab, any of that nature, make sure that you have enough for the number of patients you want to see. So take that busy time of day, figure out how many patients you want to see and how many you can see for your doctor's adjustment time. So just to use round numbers, if your doctor adjustment time is 5 minutes, and they spend 15 minutes on therapy or rehab, then you need 3 units of that whatever that might be. So you can see 3 patients in 15 minutes, and the therapy can handle 3 patients in 15 minutes. In fact, I'd recommend you have a 4th unit. And if you only have 2 and you're creating a bottleneck there, the money you spend on that equipment is far more valuable than the money you would spend on any kind of marketing. So pay attention to how much equipment you have. Make sure you have enough to match your time in the adjustment room. Last thing I want you to look at in your capacity checkup is your paperwork. And this is what the staff complains about the most when I'm in offices. So when I talk to staff, they're always like, if I ask them what's the big holdup, and they'll always tell me paperwork. He's got these reports on his desk. He can't get those out. It stresses him out, and I know it does. So find some technology that works well for you, whether it be an iPad, tablet, something that works well and is smooth and you feel comfortable doing. Maybe a dictation software if that's easier for you. Or the other way, the old-fashioned way, which I recommend quite a bit, and I have a couple clients that we've done this for here recently, is hire somebody to do your paperwork for you. Whether it be another doctor or just a staff member to follow you around as you're doing the treatment. If it allows you to see a few more patients a day and increase your capacity, they are well worth that money. It seems inefficient, but it's not. It's fantastic. You are going to be able to increase your capacity by hiring somebody to take that off your plate, not to mention the stress it takes off you. If this is a big issue for you and you can get it off your plate, it just frees you up to take care of the patients the way you're supposed to. So pay attention to all these things, get them fixed up before the first of the year, and then you'll have more space, and doing a little bit of marketing to fill up that space will really help your practice take off.